Okay, so look, thanks very much. I'm not going to talk for a great length of time. I guess I'm here in my capacity as someone who oversees largely the activities of the e-Research Centre and also the e-Research partnership with e-Solutions, which I think underpins, or I hope will underpin, a lot of the activities that we're going to talk about today and into the future. I guess the starting point really was a presentation that Paul Bonington gave to the senior management team at Monash, outlining the skills, the capabilities, the capacities and the alliances that the e-Research group have and how they work with e-Solutions. And it was clear during the discussions, I think, as Helena said, that there was not a huge understanding of what the capabilities, what the capacities and what we were wanting to do. So in the discussions after that, particularly with Christina, she asked, can you help? And I'll be delighted to help. So I want to know really where Monash Central can really add value to the sorts of things that you're doing here. So the e-Research group working with e-Solutions have responsibility for a lot of our supercomputing or high-performance computing capabilities, ranging from things like the Cave, if you want to look at 3D visualization, through Massive, which is a GPU supercomputer for rapid real-time complex data processing, through the Nectar Cloud to make those computing capabilities broadly available, not only across the university and collaborating partners, but increasingly nationally, and also Ceph, RDS, our data storage capabilities. And one of the things that we've been working on really more at the discovery end of things rather than the clinical end of things is recognizing that 21st century science requires 21st century solutions, and they're integrated solutions. And I think that's going to be the nub of what we're going to be talking about. And they use, or our e-Research team use a good example, and I'll explain it to you because I think it actually fits nicely with what we want to do with the academic partners. And talk about looking at 21st century discovery using a 21st century microscope. Now, everybody sitting in this room would understand a microscope is very simple. You have your slide, light source, you have your adjustment and focus, and you have your eyepiece. I think for us, we look at the slide or the light source as anything that generates an image, whether it be an MR scanner, a PET scanner, electron microscopy, cryo-EM, a synchrotron, anything that generates an image is your slide. And our focus adjustment is really collecting that data, storing that data, processing that data, distributing that data, and making that data more broadly available. And the eyepiece, if you will, it might be a 3D cave, but it could also be a monitor in a surgery. It could be the monitor on your desk. It's where you can collect and look and analyze that information. So really, it's looking at an integrated suite of capabilities. And I look at our platforms across the university simply as data generators. And I look at e-Research as a tool by which we can capture that data and correlate that data. So when I offered to help, it really was around what can we do with our computing capabilities at the university to make available to the clinical groups? How can we help look integrating complex data sets beyond what you might just think in terms of proteomics and genomics? It is image dating sets, it is structural biology. There are a lot of data sets there that I think could be valuably linked and integrated with the clinical data sets. Also, what sort of resources can the university put in place, not only in terms of dollars and cash, but also what is the expertise that exists across the university and our faculty of IT, within e-Research, within e-Solutions that can be brought to bear to help address this? What are the processes? There's a lot of debate around whether we should be focusing on cloud-based solutions or data center solutions. My personal view is it'll be a hybrid of both, but whether that's commercial, whether it's within the university, those are all things that I think need to be debated and discussed. We need to think about processes. We need to think about data security, safe havens. We need to think about how we can actually collect that data, how we can mine that data, how we can de-identify that data. What are the limitations? What can we do locally? What can we do nationally? And what can we do internationally? There's a lot more expertise in this room than I have that can help address those. So really what I wanted to do, and when I spoke to Helena, was for me to try and understand more about what the challenges and what the problems are, not only restricted to what's happening in the acute clinical space, but beyond that into the medical faculty in general and more broadly across the university. What sort of strategies can we put in place to help support what's going on? And I wanted to embark on a series of one-on-one meetings and try and understand what the challenges were across the university, and then perhaps hold a half-day brainstorming session to try and come up with some solutions as to try and address what these critical problems are. And one of the things I thought about was having a review of our e-research platform and try and take advantage of the international expertise across the globe, bring international people into the university and ask them to help in that review. But also perhaps during our brainstorming, develop a straw man that we might be able to put to this group of people as, are we on the right track? Is this the kind of thing we're going to do? And help me make a case towards the university to adequately resource the implementation of that. And I would appreciate from all the groups here suggestions of who should be on that international panel. It would be easy for me to stack it, if you were, for people that might be data center centric or cloud centric, clinically centric or non-clinically centric. So I think it's important that we get a good cross-section of international expertise that can help guide and help us put in place a strategy for the university to invest more broadly in our data handling, but particularly into our clinical community and what we can put in place. So I'm probably, and as a number of people here would recognise, who are friends and colleagues of past, one of the most least computationally competent persons in the room. So I really am going to rely very heavily on people providing me with input, but also look towards people like Steve and Paul in e-research, Trevor in e-solutions, and also our faculty of IT to help provide and guide. So that's really all I wanted to say. The university is incredibly supportive of this initiative. We just need to know where we can actually provide that support, what resources are needed, and how we can muster those forces to best get all that we can out of the data that we're generating. So.
And I think the other comment on that is that two things I've got to say. First is that each of the academic health science centres has agreed to lead nationally on one area, and the point is we will then be the go-to for government, and with a fair bit of manoeuvring, Monash partners will lead on data nationally, which is really important for us, but very important also for the university, because the opportunity to leverage additional investment and be pilot sites or nationally leading sites is really important. And I'd encourage everyone, especially as Ian said, to think about the university in this space is it makes that data argument critically relevant right from the very early bench top right through the translational research continuum. So I think that's actually fairly important to know that we're positioned to do that, and also that we are positioned to, we're hopefully going to specifically target a very successful group overseas, which is the Fire Institute, which actually has its key nodes in the academic health science centres. So that's one of the proposals to actually become a similar sort of network. A long way behind, but a similar sort of network to that Fire Institute, FARR Institute, who've done most of what we're trying to do in health and have learned how not to, as well as how to do a lot of what we want to do. So the opportunity to bring in the international expertise would be really critical.